and welcome to the Health Quarter. I'm Sophie Scott. On today's program, we look at new technology to diagnose spinal injuries and why botox isn't just for wrinkles anymore. It's a pregnant pause that's giving new hope to sufferers of multiple sclerosis. Studies suggest that women with MS tend to show fewer symptoms during pregnancy. Doctors want to know why, and they hope to develop a medication that mimics the effect of pregnancy. Kelly Garcia has multiple sclerosis, but like many other women with the condition, she felt great when she was pregnant with Madison.
I had a lot more energy. It seemed that my symptoms started to subside and I felt a lot better.
Now scientists at the University of Queensland are looking at the effect pregnancy has on MS.
We've known for some time that women with MS do well, have fewer relapses in pregnancy, but we don't understand the basis of exactly how that happens.
If they can unlock what's going on, they could develop a medication which copies the effect of pregnancy.
We're pretty sure that the overall effect is due to hormones like estrogen, because those hormones go to very high levels in pregnancy.
Giving women high doses of estrogen for long periods isn't possible because of the side effects.
What we're trying to do is delve down a bit deeper as to what the effects of the hormones might be.
In studies on rats with MS, researchers have worked out which genes are affected through pregnancy, and that would be the target for any new drug.
Oh, no.
Researchers say as well as the short-term benefit of being pregnant, there's probably a good long-term effect as well, and that women who've had babies tend to do better than those who haven't. It's been hailed as a breakthrough in X-ray technology. Surgeons say the new imaging system, the first in Australia, will change the way spinal patients are diagnosed and treated. The machine offers high-quality, full-body images with much lower doses of radiation than traditional technology. Rebecca Barrett reports.
This is Jamie Nuttall's first scan with the EOS imager. The 14-year-old has scoliosis. X-rays suggested a half vertebra might be responsible, but the diagnosis has now changed dramatically.
But the EOS scan quite clearly today shows that that bone itself is completely normal in terms of its shape. So that's great news.
A CT scan would have made the same discovery, but the teenager would have been exposed to up to 1,000 times more radiation.
Well, now that I know the surgery I'm going to have is less complicated, I guess I feel a bit relieved.
A scan takes between 10 and 20 seconds, and unlike other technology, it takes full-body images of the spine in a standing position. The continuous 2D and 3D images mean doctors don't have to piece together numerous X-rays.
The dramatic difference for us using EOS is that we can see all of the spine with great clarity and with great precision.
That leads to more accurate surgery. Dawn Bell was one of the first patients to have a back operation after being scanned with the new machine. The 60-year-old had spinal fusion surgery 2 weeks ago to treat osteoarthritis.
I feel fantastic. I've got a bit of a numb back, but that's about it.
Surgeons say this machine won't replace CT scans and MRIs, but it will give them more information than they've ever had before. For those suffering back pain or conditions that require repeated X-rays, it means a quicker diagnosis and more effective treatment.
There's some big news on a microscopic scale. A new research centre is working to develop medications for difficult-to-treat diseases like lung cancer. They're not visible to the naked eye, but nanoparticles could hold the key to treating many deadly diseases. They're a millionth of a millimetre, and for such a tiny particle, the University of New South Wales has created a giant purpose-built laboratory to unlock its secrets. This centre will use the expertise of scientists, engineers and chemists to target cancer at its core, rather than using the current scattergun approach.
We can actually use nanomedicine to deliver packages of drugs or chemotherapy directly to tumour cells.
These yellow dots are nanoparticles. They're being used to develop new drugs for neuroblastoma. It's the most common childhood cancer with one of the lowest survival rates.
It's the first time we're actually looking at disease states when it comes to nanotechnology.
Australia's chief scientist is hoping for big things from these microscopic particles.
The real importance is that it will take work that's been done at the lab bench, as it were, and translated ultimately into treatments for human beings who suffer some pretty nasty diseases and with pretty nasty problems.
Using nanotechnology might allow doctors to use smaller doses of cancer treatments, minimising the side effects. As well as cancer, scientists here will also develop treatments for pain management and chronic liver disease. As the cold and flu season sets in, it's worth bearing in mind that sick leave costs the economy up to $30 billion a year. Now, some companies are fighting back, introducing special programs to boost workers' health and productivity. Nicole Chettle has the story.
Even high flyers need downtime, and for Bruce Rolfe, the company gym's a good way to let off steam.
It's a release valve, and I think you feel like you're doing something to live longer and live healthier.
The gym's free for workers here, helping them stay fit while juggling demanding jobs. But the whole setup doesn't come cheap.
Some hundreds of thousands of dollars, plus the ongoing rent of half a floor in a CBD prime office building. It's been a fantastic investment in our view.
The average worker takes 8 sick days a year, costing between $25 and $30 billion. Call centres like this are staffed by registered nurses to advise people calling in sick. It makes workers more accountable, perhaps less likely to pull a sickie, and helps managers pinpoint outbreaks.
It's enormous. Some businesses are facing absenteeism levels of between 10 and 15% per day.
Demand for the service has taken off since mid-2009. It's now turning over $2 million a year.
Our business has tripled in size. We're seeing average reductions of absenteeism of around 22.5% year on year.
A focus on health's paying dividends for the corporate giant Unilever. Its Lamplighter program is being rolled out across Asia, and the early results are promising.
We have seen some sizable uplifts in just people exercising, so around 21% more people engaged in active exercise and 30% reduction in high blood pressure.
Unilever studied the impact of this kind of program in the UK and found the return on investment was more than £3 for every pound spent. So the smart money shows that when it comes to a healthy workforce, prevention really is better than a cure.
When you think of botox, most people automatically think of wrinkles and stopping them. But medical researchers think botox may help in the treatment of severe asthma. Ryan Shields reports.
Botox is more commonly associated with facelifts than frontline medicine.
I always thought it was for the ladies, to make them look more pretty.
Daniel Ryan has been a severe asthmatic all his life. The lung condition has caused his voice box to constrict, further limiting his breathing.
It's all up in the higher part of the throat. You sort of struggle to breathe, you cough, and you can't laugh or enjoy a film.
Doctors at Melbourne's Monash Medical Centre have now begun a trial to see if Botox, injected directly into the vocal cords, could relax the voice box and open up the airways.
The Botox, we think, is in some ways going to be hopefully resetting the program, switching off the computer and switching it on again.
The treatment could eventually help about 300,000 Australian asthma sufferers. Researchers concede side effects are possible.
There are some reported cases in the literature as well where there's been no serious side effect, but breathiness of the voice is something that I think we will expect.
But Daniel Ryan is willing to take that risk.
Yes, I'm looking forward to, hope to be on the trial.
The trial will run for 1 year.
Doctors already know that patients undergoing anaesthesia are at risk of developing short-term memory problems. But what's not clear is whether their memory suffers in the long term. Now a trial by Australian doctors hopes to answer that question once and for all.
You'll see at the top the numbers 1 to 9.
73-year-old Paul Ma had a hip replacement 3 years ago. Since then, he says his memory has gradually deteriorated.
I did particularly notice that my short-term memory wasn't good, so that I was forgetting. If I was given a list to go up the street, I'd regularly come back with one missing item.
Doctors at Melbourne's St Vincent's Hospital are running a trial to see how many patients over 65 having an anaesthetic go on to develop long-term memory problems.
What we've seen in people coming to have anaesthetics for different surgeries and sedation for procedures is that some people have some very subtle changes in their cognitive function and memory after those procedures.
We know that at 3 months, if we test patients, their cognition in about 10 to 20% of patients, the cognition is decreased at 3 months and even 12 months.
The research, funded by the Bupa Health Foundation, will examine patients having hip replacements. Patients will undergo memory tests before and after the operation and then be monitored for 5 years. Previous studies have found that cognitive decline showed up regardless of the type of anaesthesia or operation.
Surgery and anaesthesia evoke an inflammatory response within the body, and that inflammatory response may spread into the central nervous system.
More than a third of all operations in Australia are done on people aged over 65.
The operation and the ageing, it's hard to work out which is affecting me the most, which had the most impact on me.
With more elderly people having operations, the findings of this trial could significantly change how people are anaesthetised. It's a condition that affects half of all patients with diabetes. Nerve damage causes pain and numbness in the hands and feet, and in severe cases, infection, amputation and even death. A world-first Australian study is trying to detect the first signs of the disease to help develop new treatments. Rebecca Barrett has more.
69-year-old Bill Highfield has diabetic neuropathy or nerve damage that causes numbness in his feet. Walking is difficult. There's no pain, just frustration.
I'm worried about falling over all the time, so I have to be very careful. Every step I take, I think, is this it? You know, so it makes me tired.
There's no treatment and no way of picking up early signs of nerve damage. Researchers at Sydney's Prince of Wales Hospital are hoping to change that with a technique called nerve excitability testing.
It's a technique that allows us to provide insights on how nerves conduct electrical impulses. It's fairly painless, it's non-invasive, and it can provide very sensitive information about nerve function in diabetes.
They hope to find out which diabetics are at risk of developing nerve damage by comparing healthy and altered nerve function. So far, they've seen changes in nerve function in diabetic patients before they develop any symptoms.
And what we're hoping is the fact that if we can detect it earlier, we can offer treatments before people develop very severe nerve damage.
It's too late to help Bill Highfield, but he's happy to take part.
If it helps 1, 2, 3 people in future years, I'll have made a big difference, so it'll make me happy.
So far, there are 40 diabetics in the study. Researchers are hoping to recruit 60 more. The study has already found that type 1 diabetics are more likely to have nerve damage than those with type 2 diabetes. The next step is to find out why that happens. The researchers hope they'll have the answer in 3 months' time.
And that's all for this edition of the Health Quarter. For more health news, follow me on Twitter. Just search for Sophie Scott. And I'll see you next time.